Well, let's bring in Mario Ottiglio in Geneva. He's a global health policy expert and managing director of High Lantern Group. Thanks so much, as always, for joining us on the News Hour. When we hear the word vaccines now, we almost immediately think about the COVID-19 vaccines, as well as the massive amounts of money that's been pumped into finding a vaccine and countries buying it. But what are the differences between the malaria vaccine and the COVID-19 vaccines?
Good afternoon. Thank you for having me. Well, first of all, I will say that we are talking about, of course, two different pathogens. So we have a parasite in the case of the malaria. We have a virus in the case of the COVID. The pandemic vaccine leveraged experiences and investment based on other coronavirus and viral vaccines. And that also really helped, using that infrastructure helped really to speed up the development, aside from funding. On the other hand, the malaria parasite, it's really resistant, continues to evade, to attack in different ways, and it's scientifically just more difficult to make that vaccine. The second difference is funding. For COVID, of course, given the specialty, the first time ever that our generation has found itself in such a situation, the investment in research and development was around $6.5 billion. And then if you kind of consider all the deals that were signed prior to regulatory approval, we have like a huge figure of more than 50 billion. When you look into the malaria vaccine community, well, that community has really, for the vast majority, been driven by public sector laboratories with R&D investment that actually were trending downward. So there is really a big difference there in terms of the funding.
Mm-hmm. Yeah, you talk about this massive difference in funding. And is part of that funding problem that the majority of countries affected by malaria are in the developing world? Would more money be thrown at this problem if malaria was a bigger threat in Europe or the US?
Good one. Yes and no, I would say. Definitely there is that aspect. And you can see not just on malaria, but you can see on tuberculosis, you can see on neglected tropical diseases. Clearly, the urgency that COVID has created is difficult, very difficult to compare, with malaria and other. But the picture is not black and white, because there's been like some attempts in the past to actually create, if you want, a market for products to address some of the diseases disproportionately affecting developing countries. You can learn some lessons from some of the product development partnership that were kind of ventures really created to catalyze innovations that otherwise will not be advanced by conventional models. There are tools. We have the tools. We have advanced market commitments that, if created right, you can actually stimulate and pull some research. There are new ideas that are emerging, and some of these approaches are being studied, are being tried and tested. So I guess in part it's true, but in part we have some of the solutions there.
And Mario, besides the vaccines, what other ways can malaria be combated, and how much money is needed for things like mosquito nets or malaria tablets?
Look, this is a complex disease. There is a lot of different drivers, right, ranging from environmental factors to social inequities. The good news of malaria, and many observers say that, is that actually we have the right tools in our hand to prevent and treat the disease. Actually, we could end malaria in our generation with a combination of various elements. Prevention and surveillance tool we have, and we need more better on them. But also we have treatments, and we have a robust pipeline of emerging anti-malaria innovation that are coming up. Also looking at that, but also looking at, for instance, in the prevention side, the R&D is generating new insecticide treated bed nets. You made a point on funding. That's actually what we really need. The current estimates are in excess of 5 billion per year to address malaria, and it's been predicted to rise even more by 2030 to approximately 9 billion. The stark reality is that less than half of the needed 5 billion are currently available, despite the fact that more than 3.5 billion people, which is half of the world population, kind of are at risk from malaria. So that is really where we will need to, the community to step up.
Yeah, to step up indeed. Mario Ottiglio, really appreciate getting your expertise on this subject. Thank you so much.
Thank you.